Indica Yoga. Today's live event is in collaboration with Sagar Chandrama Hospitals. We started the week-long event on Hanuman Jayanti with a wonderful talk by Dr. Robert Swaboda and yesterday by Dr. Ananda Bhavanani Balayogi. A few weeks ago, as we planned this event, we realized how little we know about breath. In this changing world, about prana, the life force. In the ancient tradition, the rishis had done extensive research about prana and hence the system of pranayama and the importance given to breath. If awareness of breath or prana is neglected and haphazard, it creates imbalance and ill health. In the Indian ethos, we ascribe a devata to every form of life, to every activity, and prana devata for prana is Hanuman. As we sat and discussed about this program, we thought what an important thing it is for the pregnant woman or the postpartum woman to know about the importance of breath and breath control. I come from a traditional family, and I remember when I was pregnant, my mother was very, very particular. Though she was a very gentle person, when it came to the time when I was pregnant, she was very strict with rules about everything. At first, I also, as you know, a youngster, wanted to not listen to her. But on thinking, I realized how important tradition that has come down for tens of thousands of years, having withstood the ravages of time, invasions, colonizations, and the influx of globalization has still stood and withstood. And hence I thought that maybe there is some wisdom in it. And then I did find that there was a lot of wisdom in it because she stressed a lot about breath. And so when we planned this whole festival, we felt that we should have two experts on this field talk to you. So today we have Dr. Latha Venkataram and Dr. Prasanna to speak to you and give you and share with you their wisdom about pregnancy and breath. We will have our senior researcher from Center for Soft Power, Varsha Venkataram, introduce the two of them to you. I request you to please occupy your seats. Thank you, namaskar and welcome.
Namaste and good afternoon, everyone. I am pleased to introduce today's speakers. First, we have Dr. Latha Venkataram, one of the few doctors in India who is specially qualified and trained in obstetric medicine. She has extensive experience in medical disorders in pregnancy, both in the UK and in India. Dr. Latha has received her MRCOG and MRCP. She has also been awarded the fellowship of RCOG. Dr. Latha is one of the first in India to have combined clinics for medical disorders and in pregnancy, like diabetes and pregnancy clinic, recurrent pregnancy loss clinic. A consultant in Sagar Chandrama Hospitals and in Rangadurai Hospitals. We are pleased to have you with us today, Dr. Latha. Welcome. The second speaker of the day is Dr. Prasanna Narasimha Rao. He, in his distinguished career, has been constantly involved in bettering the healthcare of society in various positions and responsibilities. In his 27 years as head of the institute in SDM Hassan, he has been able to make it as an institute par excellence in Ayurveda education and healthcare. He has been instrumental in development and administration of 5 hospitals with 3 educational institutes of Ayurveda across Karnataka under the aegis of SDM Educational Society. As chairperson for Ayush Accreditation Committee of National Accreditation Board for Hospital and Healthcare, he constantly strives to better the quality of healthcare services and to enhance safety standards across India. Thank you for taking the time off to be here with us today, Dr. Prasanna. With that brief intro, I hand over the session to the speakers. Thank you.
Thank you very much, Indica, for giving us this opportunity. It's a wonderful opportunity to think about breath, the significance of breath in pregnancy and postpartum. It's going to be a combination of Ayurvedic and allopathic specialists coming together. So let us see what we understand by breath in Ayurveda and in allopathy. And we will discuss about the implications of breath in pregnancy, both on the mother and on the fetus. So, thank you. Could I request you, sir, to go ahead and present the concept of breath in Ayurveda? Thanks.
Slide change. Fetal. Well, Ajnanam Timirandasya Jnananjana Shalakaya Chakshur Unmilanam Tena Tasmai Sri Guruve Namaha. The knowledge what we have today is most of the knowledge is imbibed for last many years. I remember all gurus who has contributed into health of the society as well the individual. Today, the particular the topic of discussion is the prana, the life force in maternal health and fetal growth. Let us first understand what exactly prana means and what the medical text of ancient India speaks about the prana. Slide, please. Next. PPT. The prana is a word which is pullinga in nature. Praniti jivati bahukalinamiti. Here, pra goes for prakarsha. And this has prana has three words like pra, an, and ach. So pranityena iti karena then gachva. That means an. The word an says the chesta, the movement in the body, whatever kind of movement happens. And that is because of prana. Prakarshena chesta. That means the ultimate movements happens in the body can be the exact meaning for the prana. Prana is something that does prenana. Prenana, the word prenana goes for nourishment. It gives the life or also shows the ultimate signs of life. So prana is an evidence for Ayu. So what is Ayu? Ayu is a combination of Sharira, Indriya, Sattva, that means mind, and Atma. The combination of these four is called Ayu. So ultimately, prana is a sign of life. So what is the perspective of prana in Ayurveda? Ayurveda speaks mainly Agni, Soma, Vayu. and Sattva, Raja, Tama, Panchendriya, and Jivatma. A combination of all this is called as Prana. So, in other words, Prana are 12 in number, and among these 12, the Vayu, or the what we take breathe, and that is the major one among all 12 pranas. So, in if you look into it, this has a special seat in our body, and Ayurveda understands that the Ojas is the seat for all these pranas. Ojas is an essence of all dhatus. We have Sapta dhatus. An example, if you say the Rakta, Mamsa, Medha, Asti, Shukra, like there are Sapta dhatus. So the essence of all these Sapta dhatu is called as Ojas. So Ojas is the seat for the prana. So you can find an expression of prana in the Ojas, and if Ojas in the body diminishes, that means the prana tattva in the body also comes down. If the Ojas increases, then the prana tattva you can find very well, you can feel in the every part of the body. In one references, Ayurveda admits that if baby in the pregnancy, if delivers, if a lady delivers in 8th month, Ashtame Mase, if delivery happens, then the Ojas is Astira, because the Ojas flee into mother to baby and baby to mother. So it's unstable in the month of the pregnancy. So in that context, he says that maybe the nutrition which is supplied to the baby is Astira, and that also cause for Astira of the Ojas. So what he says, Ashtame Mase Garbhascha Matrito Garbhatascha Mata Rasaharini Vi Oja Parasparataha Adadate Garbhasya Asampurnatvat. So here Muhurmuhu, that means repeated change of the status of Ojas, even there is a fatality for the baby if it delivers at 8th month, and this was in the older days, but it may definitely, to the context today, it changes. So mainly in Ayurveda, one among Vayu. Vayu is one of the main entity. Ayurveda believes on Tridosha theory, Vata, Pitta, Kapha. Among all three doshas, Vata is the prime. So among Vata, Pranavata, there are 5 types of Vata. Among 5 types of Vata, Pranavata is very important, which is responsible for the respiration or breathing. So Pranat Jiva Dharanat Pranaha. So it helps to have the life throughout our body. It's also called as activator and continuation of life from birth to death. pranayati ananteti pranaha. All the properties of life, such as respiration, growth, digestion, reproduction, these are all attributed for Vayu. And such are these activities are put together and they are known as prana in Ayurveda, as discussed by Sushruta. The factor which keeps the body able to discharge all the life activities effectively without any interruptions. So there should not be any interruption in the activities in, say, breathing or respiration, say digestion, or the other activities. So that is considered as prana in Ayurveda. So the seat of prana, as we commonly understand with the present day knowledge, prana we considered only respiratory tract. Sharangadhara. So one of the scientists, Ayurveda Acharya, lived in around 13th century. He says the main seat of Pranavayu is Nabhi, the navel, umbilicus. Nabhista prana pavana sprishtva vrit kamalantaram kantat bahir vidiryati pantu Vishnu padodakam Pitva ambara piyusham punayati veghar Prinayan deham akhilam jivam cha jataranam Sharira pranayeva sanyoga ayuruchate. So it is totally prana or you speak about vayu is all for is for the life. Life is dependent on the prana. So the main seat of the prana is Nabhi, and from there the prana moves to Hridaya and then Kanta, and it comes out and it mingles with the Ambara Piyusha. Ambara Piyusha is what present day we speak about oxygen which is available in the environment. And it gets back once again to the body and it stimulates all the organs in the body, and it is responsible for Jataragni, for every digestion in the body. The digestion here maybe represent to the tissue level digestion, as well as the digestion which takes place in the alimentary canal. So Pranavayu is located in the Nabhi, moves upwards to the Hridaya and comes out the throat and takes back the oxygen into the body. So this is the main seat. There are other understanding about Pranavata, but this is the most appropriate and accepted understanding about Pranavayu in Ayurveda. And this the functions mainly the functions of when Vata is considered as one among the 12 pranas available in the body. Sarvahai chesta vatena saprana praninaha smritaha. So whole activities in the body takes place in the presence of Pranavayu, and in the absence there is no activity, as Ayurveda says. So Vata is responsible for all types of the movements in the living beings and represents life of living beings. Utsaho uchvasa, nishvasa, chesta, dhatugati samaha. Samo moksha gati matam vayo karma avikarajam. So what we have, enthusiasm, inspiration, expiration, and every movements. These are normal passage processing of the dhatu. Ayurveda admits that the every tissues, when they are formed, they are interrelated. Mamsa dhatu is formed because of rakta dhatu. The essence of rasa dhatu makes rakta dhatu. Like that, all 7 dhatus are formed as a nyaya is proposed here, Kedara Kulya Nyaya or Kale Kapota Nyaya. There are different nyayas. Trees like a bird, how it hunts its food. Like that, the tissues also get nourishment. Same way, Kedara Kulya Nyaya is like we have the field, and you have a channel to supply the water or the nourishment for the field. Take as an example of paddy. So same principle they have seen in the body nourishment too. So in other words, to understand easy, our body has different levels of body. So as Puranas and yoga accepts it, our body is Annamaya, having different koshas, layers. And very important, the physical body is called Annamaya kosha, and then Pranamaya kosha, Manomaya kosha, Vijnanamaya kosha, and Anandamaya kosha. This, the Annamaya kosha, which is a physical body, interactive systems, and then Pranamaya kosha. Pranamaya kosha is the Kriya Shakti here. So this Pranamaya kosha and Annamaya kosha, they are intersupportive and interrelated. And then we have Manomaya kosha, which is responsible for our Ichha Shakti or doing the things, desires. So then we have Vijnanamaya kosha. And in this Vijnanamaya kosha, the gaining knowledge, understanding. And finally, Anandamaya kosha. Anandamaya kosha, in every person you can't find that Anandamaya kosha. But till Vijnanamaya kosha, many of us, we have this. And very important, why I'm discussing this here is Annamaya kosha cannot become active unless the Pranamaya kosha which supports here. So Prana is very important to function the Annamaya kosha and also for other Manomaya kosha or Jnanamaya kosha. So what are the different factors contributing for the development of the fetus? Ayurveda admits Shad Bhavas. There are 6 bhavas which are responsible for the fetal formation as well as development. And these 6 factors are responsible for complete formation with all body parts, optimum strength, complexion, mental faculties, and compactness, leading to the comfortable and timely delivery. Those are Matrija, the maternal factors, Pitrija, that is paternal factors, Atmajascha, that is the spiritual part, and Satmijasta, compatibility, and Rasajasta, mostly the nutritional factor, and Sattvajasta. So all these 6 factors are very important. As now we discussed today with Madam, Honorable Madam, these factors has been brought in the form of symposium. They presented it, and then the Acharyas, the Acharya Dhanvantari, brought a conclusion that all these 6 factors, which are the part of the prana, is very important for a formation of the fetus and its growth. So mainly the Garbha Poshana, for nourishment of the Garbha, the embryo, mainly the mother is the responsible, and Matradinam Kalu Garbha Karanam Bhavanam Sampadaha Tata Vritthasya Saustavan Matrascha Va Upasneha Upasvedhabhyam Kala Parinamat Swabhava Samsiddhe Kuksho Vriddhi Prapnoti. So the embryo which is growing in the uterus, for which the mother's continual of the nourishment to the mother is very important, and that makes the saustava of the Garbha through upasneha. Upasneha is a kind of diffusement, and upasveda, like when hen gives fetching the egg, then chick comes out, right? The same way, the temperature of the Garbha, the environment of the Garbha is, that's called upasveda. So upasneha and upasveda, these are 2 entities which are responsible for the growth of the embryo or the fetal parts, and kala parinama, the gradually the baby gets nourishment and it develops, and it's also swabhava samsiddhi. According to the nature, it gives the development in that particular embryo. So these Shadbhavas, what I spoke about Matraja, Pitraja, or Rasaja, Satmyaja, these factors is very important. Along with that, the proper nourishment, proper Maturu Ahara Vihara. These points are very important for the growth and maintenance of the prana, mainly the prana Shakti in the body. And same way, rasa, the ahara rasa is responsible, and sharirasya abhinivritti abhivriddhi prananubandhaha tushti pushti utsaha cheti. So though this is the growth is depend on the nourishment or the rasa, the prana is very important for abhinivritti of desha. Abhinivritti is the formation, and abhivriddhi is the development. So for the formation of the embryo or fetus and the development of the fetus, for both the proper nourishment, rasa is important. That's why Ayurveda has considered rasa also as a prana. It's not only the breathing. Rasa is also equal importance has been given. Same way, satmya jascha pranaha. So satmya is also, compatibility is also considered as a prana. If only the air is inside, oxygen is inside, that is not enough. There should be satmya to the body, that particular body. So how satmya can be understood is, embryo is created by accustomed wholesome regime followed by the mother, which is known as Satmya. It's not only, say, mother. The Satmya of the paternal Satmya is also equally important, and through which the conception, right, happens. And here, for a simple understanding, starting from the entry of the sperm in the vaginal canal, birth canal, and entering to the uterus, forming the embryo or the zygote, what we speak, and environment of the internal atmosphere of this canal and uterus or fallopian tube is very important. Their temperature is important, and that should be Satmya for that particular product. Ayurveda many times is considered as the Garbha as Shalya also. Is a body, is a new body which is formed inside another body. So body should accept that product. So that should be Satmya. That's why Satmya is also considered as Prana. And from this Satmya, Arogyam, for health of mother is and baby is responsible by the Satmya. Same way, Analasyam. You know, many times heart is not formed, or the product is not viable. So Alasyam is called Alasya. So the technical word here is very meaningful. Sanskrit word. Sometimes many of us, we do not understand because it has many meanings. But alasya, analasya, and alolupatva, indriya prasada, these all are attributed before the Satmya. Even swara, varna, bija sampat, which is found in the next generation, for which the Satmya concept of Ayurveda for development as well as for product is very important. That's why these all are considered as prana. And in the development of the Garbha or the Utpatti of Garbha, these Pancha Tattvas are involved, Pancha Mahabhuta Tattvas. Among Panchamahabhuta Tattvas, Vayu has a greater role, Vayur Vibhajati. So what we have, multiplication of the cells. And for that, the Vayu is responsible. Teja Ena Pachati. So for enzymatic activities or hormonal activities, what we find, right? For which Paka, without Paka, right, you will not have the formation. So Teja or the Pitta is responsible, and Apa Kledayati, without the liquid, you cannot have formations, right? So the Apa is responsible, and Prithvi Samhanti, it gives the solidification. Prithvi gives a solidification, and Akasha Vivardhayati. So Akasha makes its growth. So Pancha Mahabhuta Tattva also very important. Among that, the Vayu takes the upper role. Vayu Yantra Tantra Daraha Prano Udhana Samana Vyana Apana Atmaha Karta Garbha Kritiin Am. So Garbha, for the proper shape or the formation of Garbha, the Vayu is responsible. So for giving a correct shape for the Garbha, the Vayu is responsible. That's what Ayurveda understands. And regarding the Poshana, once again, Ayurveda understands, right, all the Nabhi is the seat for Agni, and when Agni is blown, the Vayu blows this Agni, all the channels in the body, in the initial state, the channels in the body, Ayurveda understands the whole body is made up of the channels, minute channels. And these channels are opened because of the Agni Tattvas. So in total, Acharya Sushruta opines that inspiration, expiration, activity, including sleep of the fetus are dependent upon the mother and the prana which exist in the mother. The fetal umbilical cord is attached to the maternal rasavaha nadi, carrying the essence of mother's diet, and the fetus grows by obtaining the minute nourishment through upasneha, is a philosophy or called as a principle. And here the commentator of Sushruta says that the simile of the upasneha, how it takes place, nourishment, right? And he gives an example of the tree, how it sucks water from a nearby pond. Same way, the baby, right, attracts the nourishment from a mother through the nabi. So, what is the role of Pranavayu in the Garbha Nishkamana? Even for Garbha, as I said, Garbha formation, Garbha Poshana, as well the Garbha Nishkamana, for delivery, safe delivery also, the Vayu is very important. And among Panchavayu, the Apana Vayu is responsible for the expulsion of the fetus. Apano Apanagaha, Shrodi, Vasti, Medra, Uru, Gochara. That means the lower part of the body, especially in the pelvic region, there is a seat of Apana Vayu, and Apana Vayu takes the care of the safe delivery of the baby. So, what do you mean by protecting prana? We need to protect prana. Prana, our life is depend on the prana, and protection of prana is protection of the life. So, chale vatam chalam chittam nischale nischalam bhavet. Yogista anutvam apnoti tato vayu nirodhayat. So, vayu nirodhana. In other words, the prana nirodhana in the body is very important. Now, because of the movement of the quality of vayu, we have chesta in the body. If vayu stops the movement, our body also stops the movement. That simile, once again, the commentators gives a simile of a tree or plant. When it blows, right, when air is blown, the movement of a tree or plant is observed for a common people. So in pregnant lady, the restlessness indicates the irregular or erratic breath. So the breath, when it is erratic, so there will be restless in the pregnant lady. So there is a regularity. If regularity of the breath, mind, which makes the stable and also the peace. So the prana, which is in the body, till it exists in the body, is called jivana. And marana, maranam tasya nishkrantam tato vayu nirodhe. So marana is nothing but the total stop of the breath. So finally, the uchvasa or nishvasa this regulation is very important, for which the pranayama. So pranayama is because of the prana. The control of this prana, the control of this breath is called pranayama. So Pranavayu, the control of the mainly, there are 5 vayus. Among that, the control of Pranavayu is pranayama. And ayama here is extension or lengthening or stretching or restrain or curbing. Ayamanam. So avarodhana is the blockade or obstructing the air. So pranayama is have a control on shwasa, uchwasa. So the pranayama vayur nirodha yadyapi rechaka puraka kumbhaka vedat pranayama strividaha. There are 3 types of pranayama. One is inspiration, one is expiration, and another is holding. Holding this breath for some time, either inside, right? Holding inside, it's called kumbhaka. And once again, this kumbhaka, there are 2 types of kumbhaka you can find. This is sahita kumbhaka and kevala kumbhaka. Sahita means when we take deep breath and we hold inside, and that is sahita kumbhaka. It is kevala kumbhaka when we exhale and we hold breath for some time, and that is called kevala kumbhaka. So this pranayama, many times it helps for the proper growth of the fetus, and also the health of the pregnant women. So there are many questions, right? Whether pranayama can be done in pregnant or not, right? That we will discuss in the interaction time. And prana is responsible for our life. Prana is the sign of the life. The prana is experienced by each cells of our body, and prana is felt from other person also. The existence of the prana in an individual. With this, I conclude. We will have discussion at the end. I especially take this opportunity to thank Madam giving an opportunity to share my knowledge, and I'm eager to know the knowledge what modern medical science speaks about the prana and its relation to the maternal health and the growth of the fetus. Thank you, Madam.
Thank you very much, sir, for a very interesting talk. I think modern medicine simplifies breath as just breathing. Okay, so it doesn't probably go to the deeper aspects of living, like you said, the panchakoshas, etc. But I'll present the changes that happen in pregnancy to facilitate the maternal breathing, and also what happens in the fetus is quite dependent on the mother. So I'll just present some slides, and then, no, it's all right. Yeah. I don't know whether we can call breath as prana. We'll come to the discussion about it, but breath is the act of inspiration and expiration of air. Next, please. Through the respiratory tract, if I may specify. So the whole concept or whole intention of breathing is to keep the tissues alive. That concept is there in Ayurveda also. So in pregnancy, maternal breath oxygenates the blood throughout her system, and also carries oxygenated blood to the placenta, which obviously oxygenates the fetus. The cardiopulmonary, I would say, the system for the fetus is in the placenta. So if the placenta is oxygenated, it gets oxygenated blood into its system. So the lungs are really not functional in oxygenation. I'll come to it when we talk about the fetal breathing. Next slide, please. So what are all the anatomical changes in pregnancy? With pregnancy advancing, intestines get pushed up, the diaphragm gets pushed up because of the growing uterus. The breasts get bulkier and heavier. The chest height reduces, but the rib cage, it expands to allow proper breathing. Okay, and there is nearly a 5 centimeter displacement of the diaphragm upwards. The progressive uterine distension is the major cause of lung volume and chest wall changes. There is splaying of the ribs, and also there are changes in the lung volume. We talk about volumes in the lung, like tidal volume, residual lung expiratory residual volumes, etc., which are all altered in pregnancy, but which actually these changes make the oxygenation or maintains the oxygenation in the blood. So the enlarging uterus increases the abdominal pressure, and thereby the diaphragm gets shifted. The chest height becomes shorter, but the other thoracic diameters, that is the chest diameters, increase to maintain the lung capacity. Next slide, please. So maternal breathing, actually, as I already said, there are anatomical changes, but there are physiological changes due to the hormonal changes. That is mainly progesterone. There is due to progesterone, there is increased oxygen consumption, and it stimulates the breathing. And there is increased tidal volume, that is the breathed in air, the volume of air increases. And there is increased sighing, that is, deep breath breathing ಮಾಡ್ತಾ ಇದ್ರೆ ಪ್ರೆಗ್ನೆನ್ಸಿನ ದುಃಖನ ಸಂತೋಷನ ಅಂತ ಕೇಳ್ತೀವಿ. Yeah, so there is increased sighing, and also what is called as dyspnea, that is feeling breathless. These are all considered as protective mechanisms to increase the tidal volume, to increase the oxygenation. Next slide, please. Next slide. Yeah, I don't want to go into these graphs, but I just would like to say that the volume of breathed in air increases, thereby increasing, maintaining the oxygenation, and also the amount of air which remains in the lung reduces. Okay, because of the anatomical changes, it reduces. So there is not much of reserve oxygen in the mother. Next slide, please, which matters. That's why there can be sighing episodes and feeling breathless, etc., etc. If the breathing is more than 25 breaths per minute, that means that mother is finding it distressing. So we will have to look for causes of increased breathing. And of course, we have to look at other factors also. One of the important causes for increased breathing is infection. Anxiety is the commonest, but infection would be the next one. So usually there is a marginal increase in the respiratory rate, and there is not much of increase in the respiratory rate. Instead, the volume of breathed in air increases during pregnancy. So the physiological changes, there are chemical, hormonal changes in pregnancy. Progesterone acts as a trigger for the primary respiratory center by increasing the sensitivity of the respiratory center to carbon dioxide. Okay, so nature is very, very protective. If there is more of carbon dioxide, actually there is increase in breathing. But in pregnancy, due to the progesterone, the carbon dioxide, the sensitivity of the respiratory center due to carbon dioxide increases. In fact, it makes it more sensitive. And also, progesterone gradually increases during pregnancy from 6 weeks to 37 weeks gestation, thereby maintaining the respiration, the stimulation for respiration, and also, as I said, the volume breathed in also increases in spite of all the extra work that she is doing. So nature is very, very clever to adapt to pregnancy. The main purpose of all this adaptation is to provide enough oxygen to the baby. Next slide, please. Yeah, next slide. The prostaglandins, that is the chemical substances which are quite, found in abundance during pregnancy, various types of prostaglandins. It increases, some of them increase the airway resistance, and some of them reduce the airway resistance, thereby facilitate the breathing. Next slide, please. Yeah, thanks. Breathing pattern at rest also changes during pregnancy. There are complex interactions between changes in the chemicals, that is chemoreflex drives, acid-base balance, metabolic rate, and also cerebral blood flow. All these have an influence. For example, if there is more of, I would say, metabolic rate is more during pregnancy, the metabolism increases, 40% increase in metabolism. So the body has to adapt without much changes in the fetal compartment. So it's very important to recognize that chemoreflex driven respiration, acid-base balance, metabolic rate, and also the cerebral blood flow, all these, if they are disturbed, the breathing can get disturbed. Thereby, the baby's breathing can also get affected. Baby is, after all, a parasite on the mother, and the placenta is the lung for the baby. Next slide, please. So, oxygen consumption and basal metabolic rate increase, but to a lesser extent than the ventilatory, that is the breathing augmentation or the oxygenation. Pregnancy-induced reduction, I think it will be very technical if I went to this. Went into this, I think there is lowered oxygen reserve in the mother, as I have already told you. So she doesn't tolerate lower oxygen levels, for example, heights and things like that. And if you asked her to climb a mountain she might not tolerate. Again, nature is again and again, I would say, very clever. It protects the pregnancy. It protects the progeny. Next slide, please. Next slide. Okay, exercise in pregnant women. Yeah, actually, exercise can increase the working capacity even in late gestation. Physiological response to incremental exercise in healthy pregnant women consists of augmentation of breathed in air oxygen consumption and with higher ventilatory equivalent. That is, I mean, again, yeah, I would like to just put it as there is increased breathing rate with exercise, with increased volume of breathed in air. Next slide, please. So with this, I think, yeah, yeah. Okay, breathing in pregnancy, actually, breathing can increase even if there is a nose block. Breathing can increase in the mother with asthma, pneumonia, any other type of infection, and also, mind you, even with medications. All these have an effect on the baby's breathing pattern, okay? Especially with infection, medications, the breathing pattern can change. Most of the time with maternal infection and medications, it can come down, okay? Except one or two medications where it can increase the fetal breathing. Next slide, please. So I would like to say breathing, maternal breathing has an impact on the fetal breathing. Maternal breathing is the one which keeps the oxygenation in the placenta, thereby the fetus. Okay, so coming to the fetal breathing, when an animal is born and begins its struggle towards an independent existence, its first efforts are those of breathing. So breathing is living. That is what the modern medicine says. Breathing is living. And the onset of respiration is the beginning of life. Okay, not even the cardiac, I mean, this is after birth, not even the cardiac activity. If there is breathing, then the life is, yeah, spurana of the jiva. Okay, jiva not in the Vedantic sense. Next slide, please. So fetal breathing develops, fetus develops within a fluid-filled amniotic sac. So the lungs are full of fluid. So there is no oxygen exchange possible. The placenta is the lung for the baby. So it relies on the placenta for respiratory gas exchange rather than the lungs. And it is, lungs are not involved in fetal oxygenation again and again. Fetal breathing movements have an important role in lung growth and in development of respiratory muscles and neural regulation. So why should the baby breathe at all? Because it has to practice breathing to sustain itself after it comes out. So it wants to develop the respiratory muscles and also the nerve connections, the afferent and efferent, that is, the to and fro nerve connections have to be activated. But the gas exchange doesn't happen. So breathing, though very important in the baby, for the future breathing, it doesn't act as, as an organ or for oxygenation. Next slide, please. Next slide. So I just want to sort of take you through a bit of embryology. The windpipe is formed as early as 4 to 6 weeks, and by end of 4 weeks, you can see that the windpipe with its divisions are formed, and by 8 weeks, you have all the lung lobes defined. Very interesting. So very early. Okay, next slide, please. So, breathing efforts in human fetuses have been observed as early as 12 weeks of gestation. Fetal breathing occurs for 10% or 20% of the time. So, in 24 hours, only 10 to 20% of the time, the fetus would be breathing. Otherwise, it will be resting, because the breathing centers are not very well formed, and also the alveoli are not very well functioning. So it increases up to 30 to 40% after 30 weeks of gestation. That is 30 to 40% of this 24 hours of breathing. I mean, in 24 hours, there can be breathing. For example, in an hour, the fetus might be breathing only for probably 5 to 10 minutes or a bit more. Okay, 30% is 20. Yeah, probably it would be breathing for 20 minutes. And 40 minutes, it can be keeping quiet. So breathing takes away its energy also. So it wants to conserve the energy and grow also. So the peak incidence and amplitude of fetal breathing movements, when does it breathe more? Okay, that is between 7 and 9 in the evenings. But it is really, really resting in the mornings between 4 and 9. So with our girls having sleepless nights and working all through the night, etc., this rhythm can change. It can have long-term implications. So very important to note that there is a diurnal variation. In nature, there is a diurnal variation for everything. So even for the fetus, sleep and wakeful cycles are very, very important for proper development of mainly the brain, the psyche, and all other organ systems, as you have already very rightly mentioned. Next slide, please. So how do we detect fetal movements, fetal breathing? That is by the ultrasound scan imaging. You can see the diaphragm movements, or you can see the movement of the sternum, etc. So, and also there can be Doppler changes in, I mean, you can recognize the through the Dopplers also the fetal breathing movement in the umbilical region. Like you said, it is umbilicus is the seat of the cord attachment, umbilical cord attachment, and that umbilical cord is attached to the placenta, and that is the Jivanadi for the fetus. Next slide, please. Next slide. Yeah. So before 24 weeks, the functioning of the lung is not adequate. Actually, the lung pockets, or what we call as alveoli, the air pockets, are very much collapsed. For it to open, there is what is called as something called as surfactant, which needs to be there for the air to be blown in and the alveoli to be opened. So functioning of the lung by 24, 25 to 26 weeks and beyond, mature lung with good surfactant production is usually after 34 weeks. So that's why the baby needs some sort of help with the respiration if it is born too early, because the lungs are not mature, the alveoli don't open up. That is the problem. So as you said, in the 8th month, if the baby is born, it might not survive, but there are our neonatal colleagues here who will make it survive. But probably they are talking about the surfactant production, which increases after 8th month, and a good, what can I say, the robust alveoli, which can be involved in gas exchange, or gas exchange will be much smoother, maintaining the oxygenation, thereby not needing much of support. Okay. Next slide, please. So what influences fetal breathing movement? Of course, maternal oxygenation. And then if there is reduction in maternal oxygenation, the fetal oxygenation, it could be maternal oxygen which is reduced, or the placental oxygen which is reduced, that reduces the fetal breathing movement. So if a baby has fetal breathing, it is considered as a sign of positivity. That is, that baby is healthy, active. If it is reduced, then probably it's the other way around. But because of the spells of rest, it might not be able, and we might not be able to, spells of the cycling, I would say, we might not be able to say that the breathing, the fetal breathing is not okay. Okay, because you might have to wait for a longer duration, especially if the baby is asleep. Okay, maternal glucose reduction, okay, reduces fetal breathing. So if there is hypoglycemia in the mother, you can have reduction in fetal breathing. Medications, especially painkillers, can increase fetal breathing. Sedations, antipsychotic medications, anti-epileptic medications, all these can reduce the fetal breathing. And increase in carbon dioxide increases the fetal breathing. Maternal melatonin, that is the sleep. Okay, melatonin is a sleep hormone. So if it is disturbed, if the maternal melatonin production is disturbed, you can have fetal melatonin, or I would say the sleep pattern in the fetus can be disturbed. So that's why I said the deep sleep is between morning 4 to 9. That can be disturbed if the maternal sleep pattern is disturbed, thereby affecting the health of this individual. So the rest and the wakeful patterns are very, very important, and that also regulates the fetal breathing. Next slide, please. Next slide. So maternal snoring can reduce the oxygenation and can reduce the fetal breathing. Okay. If the fetal breathing is reduced, it means that it is trying to conserve its energy. Okay. Obesity, obstructive sleep apnea, that is, again, oxygenation is reduced in the mother, thereby the fetus can also have reduced oxygenation. Chronic blood pressure, because the vessel might not allow much blood circulation and there might be reduced oxygenation. Blood pressure in pregnancy, and also there is a condition called as preeclampsia, which is associated with blood pressure affecting the various organ system. All these can reduce the blood oxygen, thereby the fetal oxygen, thereby the fetal breathing can be reduced, showing that baby wants to conserve energy. Asthma at night. I always tell my patients, please avoid getting an attack of asthma, because that is more harmful to the baby because of the reduced oxygenation in the mother. Medications, many girls are very apprehensive to take, but I feel the medications, especially the inhalers, just go into the lungs or they are breathed out. Okay. But if they have an attack of asthma, that is more harmful than the medications can cause. Panic attack. Nowadays, panic attack has become a very, very fancy word. Anxiety. Okay. I already told you about the cerebral blood flow, acid-base balance. All these are affected or altered with panic attacks or anxiety. The sympathetic tone, what can I say? The autonomic nervous system has to be in balance. So if the mother is in good balance, the fetus is also in good balance. Next slide, please. So fetal breathing is regulated by unique intrauterine environment, which is provided by the mother. It's just not the genes. The father and the mother are just not contributing the genes, but the mother contributes more. That is, she contributes to the intrauterine environment, which affects the functionality of the gene. So the prominent distinctions of fetal breathing movement include its episodic nature and apnea. That is, apnea is non-breathing, which is sensitive to hypoxia. That is, as a result of hypoxia. Basis for using FBM in the assessment of fetuses at risk for hypoxic injury is, the fetal breathing is used as a sign of wellness if it is present. I wouldn't say illness if it is not present, because it can be, it has cycles and patterns. So we might have to wait for a longer duration. The ultrasonologist might have to wait for a longer duration to pick up fetal breathing. So next slide, please. But if one saw fetal breathing movement, that means that the baby is healthy. Okay. So long-term effects, fetal hypoxia or drug exposure may in later life dispose to sleep disturbances in infants and children, and adults to hypertension. Okay, as an adult, if the fetal breathing, if the intrauterine pattern of breathing has been disturbed, they are more prone for blood pressure in later life, diabetes, brain injury, and even sudden death as infants. So breathing has got a very big role to play in the fetal development, and also it's a reflection of fetal well-being. Next slide, please. Birth, the transition from fetal to postnatal life critically depends on a timely transfer of respiratory gas exchange from the placenta to the newborn's lungs. So it has to, the newborn lung has to take over the breathing function. So it was just lazing out depending on the placenta. But once the baby is born, I think it's very important to note that the newborn's lungs have to cope. The first breath is really it is the expression of life. Next slide, please. So at birth, the transition to continuous postnatal respiration. So it was periodic, etc., etc. It was just thinking that placenta will do the breathing for me, etc., etc. Now it has to exist as an individual. It has to breathe. It has to look after all the things, the whatever you, all the dhatus, all the ojas, all the everything, all the panchendriyas, everything is dependent on the oxygenation, as you have already put it across. So the fall in temperature, it would be quite a warm temperature within the uterus. So once it comes out, the fall in temperature itself is a stimulus for breathing, and gaseous distension of the lungs, if the alveoli are mature, that in turn stimulates the breathing. So the chemoreceptor and baroreceptor, etc., are there, which regulates the respiratory effort and also the rhythm. Okay. and thereby the oxygenation. So first cry is evidence of breathing, okay, at birth. So next slide, please. So the transition from fetal to postnatal life, yeah, I have already said this. So how successfully it adapts to the extrauterine life is very, very, very important. And the first cry carries significant information about the mental and physical well-being of the baby, like one of the Mahagurus has very clearly documented. Okay, so I think it's very important to know how this human being is going to exist. That is reflected in its first cry. Next slide, please. So we pass more biological milestones before we are born, and in the early few minutes and months of life than of any other times in our life. How we pass these milestones will be greatly affected by our first environments in the womb and immediately after birth. So the biological programming, that is the hardware development, is mainly in the uterus, 98%, and 2% of it is up to the age of 2. And what you're going to put in is only the software. You cannot change the hardware. So maternal breathing and fetal breathing have got a profound, what can I say, interdependency, and fetal breathing in utero has to be synchronous, and mother has an important role to play in the development, regulation, maintenance, and what can I say, even after the child is born, for it to live on its own. So with this, I would like to say that this is the modern medical what can I say, modern medical concept of breath, the maternal and fetal breath. So we don't call it as prana. Prana has got much, much deeper meaning to it. We just simply say that oxygenation, it's almost equal to breath is oxygenation of the mother and the baby, or it is oxygenation is the result of breathing. And of course, the breath, the very, I would say, the very next breath, what stimulates us to take the next breath is not in our hands. It is so very complex. And precisely as Mrs. Vijayalakshmi said, there has to be a control system for the breath, for everybody's breathing, and for the universal breath. And it is depicted as Hanuman in our ancient literature, which is, I think, very much acceptable if you thought more deeply. Thank you.
Madam, now exactly the breathing and prana, they are very nearby. Maybe prana has more meaning, but breathing also has more meaning. So now to regulate this prana, breathing is very important. Without breathing, there is no life. Prana is very important. Without prana, there is no jivan. So this pranayama, as you said, after looking to your slides and understanding, oxygenation is very important. Now, how good practice of pranayama, what now practicing everybody. Will you advise this pranayama practice in the pregnancy? And if it is practiced, how it helps to the mother and fetal growth?
See, pranayama, in the deepest sense, it regulates the pranic flow. Okay, yeah. But if I can simply say that it improves the oxygenation, there are studies to say that pranayama improves the oxygenation and brings about a harmony or a balance in the autonomic nervous system. It reduces the autonomic, the sympathetic overtone. So all these have been proven as a result, to be the results of pranayama. So I think it's very important for women to do pranayama, pregnant women to do pranayama. And also it not only improves their breathing, but actually it brings in autonomic, stability in the autonomic nervous system, which in turn controls the mind, that is the brain neurotransmitters, etc. So I think it's very important that women do pranayama during pregnancy, but I would say probably without kumbhaka, breath holding, because there are changes in the lung volumes. We don't know how it works and what effect it has. So pranayama is very, very important. Couple of things I wanted to just add on. See, you said probably breathing has much more deeper meaning, but that is so in Ayurvedic medicine. Okay, but breathing in modern medicine is mainly for oxygenation and also increase in breathing, reduction in breathing, or what can I say, asynchronous breathing, etc., etc., can be in diseases or secondary to medication, etc. Okay, but in Ayurveda, I think the changes in breathing, especially the changes thereby, the changes in the nadi, probably can even detect a disease, isn't it? So I think it has got much more deeper meaning in Ayurveda. That's what I feel. And we don't talk about, we say breathing is a sign of living, but we don't talk about ojas. We don't talk about ojas as the seat of prana, etc. So there are a lot of differences. I think this breathing, just taking in the air, inspiration and expiration, has got much more meaning to it rather than just, through the nostrils you breathe, it goes into the respiratory tract.
Namaste all. Kindly wait. Yeah, the speakers joined just now. It's a technical error.
In the oxygen, today what we know is oxygen. But people were breathing. Today we know that there is a gaseous exchange takes place. Thousands of years back, people understood that this is taken through the nose and it moves to the lungs or heart and reaches up to nabi, and it's responsible for spreading energy to throughout the body, and it nourishes the tissues. It is responsible for Agni, that means digestive fire in the body. So it has, I think that breathing has a much more meaning, and especially in the fetal growth. What Ayurveda says is in the Nabi, it is the seat of Agni. When air is blown through this Nabi, entire the channels of the body and start functioning or activating. So maybe some important. Yeah.
Oxygenation is only due to breathing. Yeah. Whether it is active, passive, that is even like ventilation. Yeah. It is the tissue oxygenation is just due to breathing. So I think breath maintains the life, and life is recognized by breath. And Hanuman is the one who takes or gives prana. So I think that is where we have to sort of agree upon and say, well, Ayurveda has much deeper concepts, and it calls breath as prana, and has got a lot to say about the activities of prana, whereas science, modern science says it is breathing, oxygenation, tissue perfusion, and functioning of tissues.
In total, it means the prana is the force which keeps us alive. And if prana is not, the continuity of prana or the oxygenation is not in place, then that is the other, the meaning for that is the death. So prana is very important. Either you say through science or philosophy, prana is very important and life is very important. Most of that's why maybe Hanuman is called a prana devata, right? So that is in Indian philosophy. But everywhere in the world, people breathe, and prana exists in each one of them. And for this continuation, yes, the starting of the prana is one, and continuation of prana till death is another one. And what do you think? What makes lengthening of our life with the continuity of this prana flow? What do you say, madam?
It is a difficult question to answer, because if you slow down the breath, slowed down and slowed down, the breath will be attained something like a hibernation, which will again prolong our life. Is a question whether the telomere shortening, that is the aging, okay, the cause for aging is the telomere shortening, whether that will be prevented by sort of reducing the number of times that we breathe, is a very difficult question to answer. Lot more of research is required in the direction if we have to claim that. But what makes one stop breathing is a question which cannot be answered easily.
A very important point we reached is what stops our breathing. Breathing is a sign of life, and if we prolong our breathing through our history and the knowledge what we have, we understand that the life can be also length of life may be increased, but this to the world, for the common understanding of the world, much more research is required in this field to realize ourselves that the prolonged breathing will increase our life. Or yeah. So thank you very much, and special thanks for Latha madam, and also special thanks for Vijay Lakshmi, Vijay Kumar, and whole team. Society is benefited by this. I'm sure the society is benefited, and we also benefited. Thank you, madam.
Thank you both very much for this wonderful 1.5 or 2 hours that has gone by without or even realizing it. I think the time for an integrative approach is very fast approaching, or I should say we are already late. So I hope that this is the beginning of a series where we can bring together our traditional systems and the best of both. So the person who has to benefit is the patient. Doesn't matter what system, but the best. So we would like to give you a small token of our appreciation. So, and thank you, sir, for coming all the way from, no, here, no, this is for you. Thank you for coming all the way from Hassan, and thank you, madam. Thank you, namaskar. Our program tomorrow is also a live program, and it's going to be also on the live stream. We are going to have a very interesting music and Katha program. Katha Gana Samarpana by Vivek Sadashivan and Vinay Varanasi. It's all about breath, prana, and Hanuman from our Shastras and from our traditional music. So we look forward to all of you being there with us. Thank you. Namaskar.